think Jen McEwen just summarized what's been going on the last few years when she said when she started running, and she wants all these progressive groups who are going to be on board with what her constituents want, what she knows we need to do. They say, could we fight for something little tiny that won't really do much? And that's what we've been having for so many years, and it's so wrong. And as she pointed out, yes, it is the money in politics that's stopping it. And we're not ready to do more tinkering now. We want to do more. And this morning we had, I think, a very successful hearing. We didn't have the fiscal note yet, so we didn't have a vote on the patient-centered care bill, which would do at least get the insurance companies out of the 1/4 of the people who have the most difficulty accessing health care, those at the bottom end on the public programs, who get pushed aside. And when Jen was saying there are so many reasons for this and trying to explain, well, number one reason we want patient-centered care is so patients get better care, and the health plans would keep saying how they're coordinating their care and delivering this wonderful care. And all our stories are people, how the health plans coordinating the care and managing the care are putting barriers to care up, and they call that managing care. That's managing their claims payments. And that was absolutely clear, and we had very positive stuff. We would have had the votes to get it out if we had the budget to show what it would do, because we believe it'll save money. And when I hear people doing these, oh yeah, but we're going to be realistic and we're going to fight for mush. I think the message we have to give is you talk to legislators, you talk to people who are in that camp and say, especially elected officials, if you are thinking, well, the best we can do is mush, so we're going to fight for mush, you say, well, if you don't support actually moving forward on reform, could you step aside and let somebody else who believes we can do it? Because it's always, well, we can't really get there. We can't really get there. It's not politically realistic, which is the most self-fulfilling of all prophecies. It's not going to get there. It can't get there. We don't have the possibility. Why? Well, because I'm not going to support it, and I don't want it because it doesn't have a chance. That's the reason we never get things done. And I still like to quote how in 2008 I dropped in the first marriage equality bill, and I said at the time, it wasn't a prediction, but trying to get people out of that mindset. The zeitgeist, as she said, about how we can't do anything. And I said, I thought we could pass it in 5 years. And it actually did become law, not exactly the path I would have seen, but we actually did pass it in 5 years. Some guy came up to me afterwards and said he wanted to apologize. What for? He said, well, he heard me say that in 2008, it could pass in 5 years. He said, I heard you predict in 2008 it could happen, and I knew it wasn't going to happen in my lifetime, so I told my friends you were nuts. And I told him I wasn't making a prediction because I can't predict the future. None of us can. We can't predict where we'd be in this country right now. None of us thought this was going to happen. But the experts who say this is politically realistic, they kill off any attempt to do anything real because it's not politically realistic. And I think it's time to start moving forward and pushing aggressively. And I think, and I want to make sure next year we pass the patient-centered care bill, and that sets us up for a year later, so pushing for the Minnesota health plan. And that's what every one of you, especially I see lots of doctors and nurses here who've been involved in this for so long, you see the pain and the suffering of people. And health plans, they put up one witness today I'd never met before, and she basically, we do all this care coordinating, and the patients are going to suffer. Even though all the providers are saying the patients are suffering because of your managing. And we can't just keep accepting their things. And one of the Republicans on the committee said, well, but one of them who's a chiropractor said, you know, the trouble is now we're undercompensated and we have to fight for prior authorization for all these different health plans and so on. Now we only have one, meaning the state, we only have one to fight against. And I thought, first of all, we want a lot less of the prior authorization and more of the medical providers making medical decisions, not insurance company executives doing it. And everything they were saying were things that this bill, the things they were criticizing, tended to be either misunderstanding what's happening or a belief that we should go further. And I keep thinking, I'm all in favor of going further, and we have to go further. But we're making progress now. when I see how much this has turned around, I think in our caucus, I think there's pretty growing close to very solid support, and a few of the good old boys of whatever gender, or the, because there's some female good old boys around. And despite whether we call them dinosaurs or whatever, some people are retiring from office and leaving newer people who understand the merits of this to happen. And I can't say enough how Healthcare for All Minnesota has been such a resource in terms of providing information and data and doing the digging. And PNHP Minnesota is getting physicians and others together to come and talk to people. We had one guy come up, I had two witnesses, one from Connecticut who talked about how in the 15 years since they've saved it, they've gotten much better care for the patients. The providers are much happier. They got more providers in the system, and all the questions were, we'll have fewer providers if you do this. And he said they've saved, according to a study a year ago, he said that they had saved over 14%. And that may not sound like a lot of money, but in Minnesota, Medicaid is costing us $19 billion a year between state and federal funding. And 14% of that is into the billions, you know. And we ought to be fixing that problem. We ought to fix it now. And so I'm excited about it. I believe we actually have a path to go forward, certainly on this bill now. And there are people, some of the people at DHS are, I think, very helpful and supportive of it. There are a lot of others who, we could never do this because we know managed care works. I thought, it's time to give up. After 4 decades of managed care, how we're going to do more administrative steps will save us health care costs, which they still believe. And they always seem to forget about the cost of the management and the cost of the administration. And certainly the cost and pain that providers have spending all their time trying to fight for approval for the care they feel the patient needs. And I am one who, I've committed, and I keep saying this, and we got to do it sooner rather than later, though, because I'm apparently already the longest serving state senator in state history. And that was not a goal of mine, and it's not a goal of mine. But I'm not willingly leaving until we get health care for all. And so thank you for all you're doing. I look forward to seeing you. Please meet with your legislators and tell them, if you can't do this, what do we do? And related to that, and I'll close with this, but I'll say that there's this one group that includes a lot of the unions and progressive groups and legislators that puts together a DFL agenda always for the last number of years. It's a good idea, values, what the DFL values should be and so on. And several years ago, they had 2 of their provisions I'll mention. One of them was everybody, 2 of the visions. One was every worker deserves time off to take care of their family and themselves when they're sick or a new child or whatever. Every worker deserves that. And this group always puts together their vision and then action steps to get to the vision. And then they also say healthcare is a right and everybody deserves healthcare. And the follow-up step for paid family and medical leave was, why don't we propose paid family and medical leave for every worker in the state? And they did, and we passed it into law, and it just took effect this year. And somehow, the message for health care for all, it's a right, everybody deserves it, the action step. Well, let's propose this public option so that if you're not covered by public program and you're not covered by your employer and you're buying in the insurance individual market, then maybe if we spend enough more money to subsidize this, then you can buy into this supposedly public option, which is run by insurance companies. You can buy into that, would cover 3% of the people, cost $500 million to implement, and basically people who choose to get much better benefits, which will tend to be older folks and so on, which is a good idea to do them, but we don't have, that's 3% of the public that will get a little bit better care. We don't have that kind of many billions of dollars more. We're already spending too much. So we need to tell those groups, in the same way, when you have a vision, everybody deserves paid family and medical leave, let's just do it. If you think every person in the country deserves health care, let's just do it. So thanks again for all you do. I look forward to keep teaming up with you and my colleagues, many wonderful colleagues now supporting this. We're going to make it happen. Thanks.